Where I was doing medical school and basic science research, I really fell in love with neuroscience. I'm a neurologist at the Mellon Center for MS. My specialty is in neuroimmunology, where I see patients with multiple sclerosis and other autoimmune disorders affecting their brain and spinal cord. Sometimes the symptoms can be very vague. It can be brain fog, fatigue, and often the clues that we're looking for are focal symptoms, symptoms affecting one eye, one arm, one leg, one side of their body. So I think the most important thing is getting a good history. So often we can kind of put the diagnosis in different categories depending on whether the symptoms appeared over many years, months, or days, hours, or minutes, or seconds. We do a thorough neurological exam to look for any signs where the brain and spinal cord could be impacted. We get a good medical history, social history, and then we often have records from patients who have been seen at other centers or hospitals. The type of care you'd receive from me would be probably very interdisciplinary. Follow-up is typically twice a year in people with established diagnoses. A lot of times if you have symptoms, we can address them via phone call or MyChart, or often we can do a follow-up visit. And we offer virtual visits as well as in-person visits. I can kind of confidently tell them that we have effective therapies to stop disease activities, to stop new lesions from affecting their brain, their spinal cord. I kind of enjoy the newly diagnosed patients, but then also patients that we continually see over time. We establish a very good rapport. I usually have a smile on my face seeing patients, and I think that kind of really brings me joy, and then it also helps motivate me to do research. And I kind of think of research and clinical care as not two separate worlds, and it's nice to be able to do work that bridges the two. So sometimes patients come here for treatment options that may not be available elsewhere. When I'm not at work, I'm a weekend warrior. Usually look up how to do things online and kind of just jump right in and try to do things at home.